Now, we spoke about the spinal muscular atrophy. I'll say that spinal muscular atrophy is subdivided into three types. Like, it has three types. So we said type 1 is what? The Werdnig Hoffmann type. Type 2 is a Dubowitz type. Type 3 is a what? Kugelberg, Welander. Where there's another type which is basically adult onset. But that one is just occurring when somebody is 20 years, 30 years. You understand? These ones are the special types. So let's discuss them together. So I have the pictures. This is the what? Werdnig Hoffmann. This is what? Dubowitz. This is what? Kugelberg, Welander. So these names that we just listed are three classic types of what? Spinal muscular atrophy. Now, spinal muscular atrophy is not a single disease. It's a group of what? Neuromuscular disorder. When they say neuromuscular, is something that is affecting how the nerves and the muscles should communicate. So it's characterized by progressive degeneration of motor neurons in the spinal cord and the brainstem. So this will now lead to weak muscles and atrophy. Okay. So spinal muscular atrophy is just mutations in a gene known as what? The SMN gene. Okay. So the SMN gene codes for a type of protein in the body known as the survival motor neuron protein. So if the gene is affected, the survival motor neuron protein is also affected. So inheritance is autosomal recessive. Spectrum is classified into types based on the age of onset and severity. So let's look at them one by one now. So the first one is a Werdnig Hoffmann. This is it. The baby was sitting, but all of a sudden it's too weak, so it just fell. Get. So infancy usually occurs between 0 to 6 months of life. So there's severe hypotonia, that's floppy baby, poor head control, difficulty swallowing and breathing, and they can never sit independently till you support them. Alright. So prognosis is more severe. Without treatment, death can occur before the child hits age 2. Then type 2 is the Dubowitz. So it occurs around age 6 to 18, can sit but can never walk unaided. It's progressive weakness, there's tremors, there's scoliosis, there's respiratory issues. So there's an intermediate severity. So they can survive into adolescence or adulthood if you keep supporting them and treating them right. Type 3 is a what? Kugelberg, Welander. So it starts after 18 months to adolescence. They're able to walk initially, but the muscle weakness start progressing. So there's frequent falls. Okay, so it's actually the mildest. So if you treat patients with this type 3 right, they basically get to survive for a very long time. So diagnosis, you get to confirm that there's mutations in this gene, then electromyography, clinical examination. So you treat them using all those disease modifying therapies like the nusinersen, the anasemnogene pervovec, okay, then the risdiplam, then supportive care, respiratory support, nutritional support, physiotherapies, and the rest of it.